Ano na nga ba ang lagay ng ating bansa kaugnay sa COVID-19 perspective po ng World Health Organization? Pulpurian ay makakapanayam natin ang WHO representative to the Philippines na si Dr. Rabindra Abeyasinghe. Good morning, Dr. Rabi.
Good morning. Happy to be back.
Our health department and the people from the academe expect a rise in COVID-19 infection. DOH confirmed that the surge of cases will manifest this week. And yesterday, the number of new cases breached the 2,000 level once again. From WHO's point of view, is the Philippines ready for this situation?
Secretary Handa, we have told from the beginning of this pandemic that this virus is transmitted when people come into close contact. That is why physical distancing was advocated right from the beginning as a control measure. We've seen over the holiday season that these physical distancing requirements have not been followed. There have been a lot of movement, a lot of get-together, and we've seen most recently on Saturday with the Translación in Manila, a massive get-together of people violating the physical distancing needs. This kind of close contact will give rise for further transmission of the virus, for further infection of new people. So it is inevitable that the Philippines is going to see an increase of cases. We have been working with the DOH to keep people informed on the need to follow the physical distancing, to follow the key guidelines on wearing face masks, face shields, and hand hygiene to minimize this risk. Now the question is, with the increased transmission that we are seeing, how fast can we bring that under control? How ready is the Philippines? And again, it comes to the systems that have been used since January last year to suppress transmission. Again, we advocate that we need to push for very early identification of cases, the sharing of that information with the contact tracing team so that effective early contact tracing and management of contacts and potentially infected people can be done effectively so that the chains of transmission are interrupted. This is critical, and we believe that with the holiday season, some of the cadres that were recruited for contact tracing and management are still awaiting contract renewals. This could hamper having an effective response to this surge, and it is critically important that the DOH and the LGUs put in place mechanisms to already initiate those early actions so that further transmission can be reduced, suppressed through early quarantining, early isolation, early testing, sharing of information, not only with the relevant surveillance units, but also with the community at large so that the community can avoid those 3C situations where we know that increased transmission happens so that we can bring this situation rapidly under control. Thank you.
United Kingdom, Japan, Thailand, and other countries have also experienced a new wave of COVID-19 cases. And they are now imposing another round of lockdowns. Why is it happening across the globe? And should the Philippines impose again a strict quarantine protocol?
So we've seen that since the announcement of the new variant on the 14th of December, many countries have implemented stringent measures to reduce the likelihood of importation of these new variants, which are recognized as having increased transmissibility. WHO would like to reiterate that even for these new variants, the measures that we've been advocating from the beginning of the pandemic are the mainstay, are effective, and need to be implemented with increased vigor and discipline so that we can delay the introduction of this virus, and when the virus is introduced, so that we can manage it well. In this regards, the Philippines has been implementing more stringent procedures at the points of entry and also relating to contact tracing. These efforts need to be doubled. The whole idea of the pandemic response that WHO has been supporting the government of Philippines is to minimize the economic impact and minimize the deaths so that we can keep the country open and functioning. So it is now time that we use those efforts to prevent the need for another big lockdown by initiating early action to identify and suppress potential increases in transmission, whether they are due to the wild type or due to the new variants.
Philippines have more than 100 million population. Currently, the government is eyeing to inoculate 50 to 70 million Filipinos this year. Will it be enough to eradicate COVID-19 infection in the country?
So that's a good question, Martin, and thank you for that question. Let me start by approaching this question from another angle. What we have now are vaccines that are being authorized for emergency use. These vaccines have been shown to be effective in reducing deaths and reducing severe disease. Not all of them have been shown to be effective in reducing transmission. So the key issue is that these vaccines that are granted for emergency use listing and use is because they have not gone through the stringent safety assessments that are normally required, which normally happen with normal products because of the pandemic. And in the case of the Philippines also, the vaccines that will be introduced need to be used so that we can minimize the impact of the pandemic by protecting the most at risk, meaning the frontline healthcare workers, particularly, but also protecting the most vulnerable, the elderly, and people suffering with comorbidities. In this way, if we use the vaccines in a very careful way, we can, and targeting them for the high transmission areas initially, we could then minimize the impact of the pandemic and hopefully bring back economic activity early. The vaccine rollout is going to take time because on the global scale, vaccines are not available to roll out immediately. So there's going to be many types of vaccines that will need to be accommodated. There's going to be different conditions necessary for the administration and storage of those vaccines. But the key issue is that we have, and the Philippines does have a plan where we are looking at early implementation and early maximizing of the impact of the vaccine. So these are good things. The government is advocating a whole of society, whole of government vaccine rollout plan. This is good. This needs to be built upon so that we can maximize the benefit and bring back economic activity and reduce the deaths from this pandemic.
Let's entertain questions from our media partners. Yusek Rocky, please go ahead.
Thank you, Secretary Martin. Good morning, Dr. Rabi. We have a question from Joseph Morong of GMA 7. Is it safe to use Sinovac in the Philippines? How about Sinopharm?
I would not refer to each of the individual brands of vaccines because many of these vaccines are currently still under evaluation by their national regulatory authorities and by stringent regulatory authorities in countries that are recognized to have these. From a WHO's perspective, we have currently granted emergency use listing only for the Pfizer-BioNTech vaccine. WHO is currently reviewing several other candidate vaccines, including the Sinovac vaccine, and once the emergency use listing is authorized by WHO, we will be in a better position to comment about them.
We have a question from Evelyn Quiroz of Filipino Mirror. The World Health Organization is studying the recommendation to exclude children under 16 years old from the COVID-19 vaccination program. Will the results of further studies on the matter be available soon?
Thank you, Raki. As I mentioned already, the vaccines are currently cleared for emergency use listing, and the trials did not involve children because of the lower risk of disease in children, but also because of the critical importance of ensuring the vaccines are safe in the first place among adults before they are tried on children. So what we have now is a clearance for the use of vaccines in people above 16 years. As time goes, as global experience increases, it will become clear whether these vaccines can be used for children and whether they are safe and effective. Once we have that evidence, we can consider the option for vaccinating children. But this is a process that is ongoing. We are closely working with the vaccine manufacturers, the academia and the research partners to better understand this. But the key issue is that that is going to take time, and maybe in a few months we will have better evidence to confidently say that these vaccines are safe and effective for children.
Okay, another question from Joseph Morom, Dr. Rabi from GMA7. Why can't the WHO grant emergency use authorization for Sinovac or for Sinopharm?
Confirm that the relevant dossier was shared with WHO only last week, and so we will need some time for review of the dossier and for site visits, which WHO undertakes. Once this process is completed, WHO will grant, based on it meeting the requirements, will grant emergency use listing for Sinovac if that process is found to be satisfactory.
From Red Mendoza of Manila Times, multiple public opinion surveys have shown that Filipinos are still worried about the future vaccination program against COVID. How is the WHO addressing this?
Yes, we are very much aware of a Pulse Asia survey which showed that the acceptance for a vaccine, COVID-19 vaccine, is quite low in the Philippines. I like to draw attention to the fact that the Pulse Asia survey was conducted at the end of November, before the 2nd of December, and that was the time when we did not have emergency use authorization for any of the COVID vaccines. So that question was asked in a space where nobody knew about the possibility of COVID-19 vaccines becoming available so soon, and about their safety and use in other countries. So we need to revisit this question again. We know that there is vaccine hesitancy in the Philippines. We need to be clear and transparent with the Filipino public that these vaccines are not authorized, given market authorization, because they are still under emergency use listing. And that is why it is necessary for countries to have in place systems to monitor potential side effects and report those. And that is why we have an emergency use listing, and that is why the vaccines are being used advocated for use in places where we need to rapidly bring under control the pandemic.
Opo, still from Red Mendoza, almost a year since the Philippines detected its first COVID case. How would the WHO assess the overall response? Is the country's response adequate enough to combat future pandemics?
The country has been gradually improving its capacity to respond, as is with many other countries. We found that the Philippines also was challenged with the advent of the pandemic, and of course its very close proximity to the origin of the pandemic meant that there was increased transmission because of the very close exchange and movement of people between the origin and here. But over the months, we've seen the Philippines gradually increasing its capacity to address the challenge of this pandemic, and we hope that those capacities can be established and strengthened and systematized so that the country will be ready to deal not only with this pandemic but with possible future pandemics.
What is your message to the Filipino people who are still afraid of the pandemic and its effects?
Our message is the same. We have reiterated from the beginning of this pandemic that it is incumbent upon each one of us to do everything possible to limit the transmission. We cannot expect governments or local government units to help control the pandemic. It is incumbent upon all of us to adopt the behaviors and the practices that are necessary to interrupt the chains of transmission by practicing frequent hand hygiene, the wearing of masks and face shields as appropriate, the physical distancing, and the avoiding especially of those situations that give rise to increased transmission. I refer particularly to those three situations: closed areas, crowded situations, close contact. We need to minimize these so that we can interrupt the transmission, because if we avoid these, the virus cannot go from one person to another person. We minimize that and we break the chains of transmission. This is the message that we reiterate again. And even with the introduction of the vaccines, we will need to continue these behaviors and practices till all of the people that require vaccination are vaccinated, because the vaccine is just one tool in the arsenal against COVID-19. Just because people are vaccinated, it does not mean that we can give up these key behaviors.
Thank you very much, Dr. Rabi of the WHO. Please stay safe, sir.
Thank you, Martin. Have a good day.